22 months since the first case of COVID-19 were reported, and almost a year since the first vaccines were approved, reported cases and deaths from COVID-19 are increasing again. More than 5 million deaths have now been reported, and we know the real number is higher. We're still losing more than 50,000 of our sisters and brothers every week. Last week, 56 countries from all regions reported an increase in deaths from COVID-19 of more than 10%. Yesterday, we added another new tool with the emergency use listing of Covaxin, the AIDS vaccine to receive WHO validation for safety, efficacy, and quality. Emergency use listing contributes to vaccine equity by enabling countries to expedite their own regulatory approval to import and roll out vaccines. We continue to hear excuses about why low-income countries have only received 0.4% of the world's vaccines. One is that low-income countries can't absorb vaccines. That's not true. With the exception of a few fragile, conflict-affected and vulnerable countries, most low-income countries are ready to go. The problem is simply that they cannot get the vaccines.
Thanks for taking my question.
So even where we're not seeing the same increases in hospitalizations as we saw earlier in the year, a smaller number of cases is placing an even greater burden on the system because the systems are tired. The people in the system are tired. They're still fighting very hard, but it's very hard for them to be able to react in the same way. It is very difficult to sustain the kind of effort that's needed on everyone's part. On the part of health workers, on the part of communities, on the part of government. There's exhaustion, and exhaustion is leading to complacency, and complacency is leading to gaps in our system. Gaps in testing, gaps in clinical management, gaps in vaccination. And it is through those gaps that we see transmission. It is through those gaps that we see the hospitalizations and the deaths. And we need to close the gaps.